So yeah, my name is Alice, and I'm going to be talking about my work on the effect of booked appointments on waiting times at urgent treatment centres specifically. So just to start with a bit of background, so the NHS 111 started out life as a simple telephone health advice service, but thanks to a lot of work over the last few years, it's now much more embedded in the system, and call handlers are able to direct patients towards services that are near them that will be able to meet their needs, and even in many cases book them into a booked appointment slot at those services. And there's now an ambition that 70% of patients who are referred to emergency departments by NHS 111 should be given a booked time slot to attend. So it's hoped that this will make things more convenient for patients, but also help emergency departments manage demand and even lead to improved waiting times. But there's lots of questions about kind of to what extent that might improve waiting times and what the mechanism might be. So that's the question my project was aiming to answer, and I used discrete event simulation to try and answer that question. But you may have noticed I'm focusing specifically on urgent treatment centres, and that's because in an emergency department, it's well known that most of the time, waiting times are caused by delays admitting the patient to an acute hospital, whereas urgent treatment centres are intended for patients who have an urgent care need which isn't life-threatening. So patients tend to have lower acuity, and a lower percentage of them need admission to a hospital bed. That makes them easier to model in isolation. So that's why I focused on this case. Also, there's this handy document of principles and standards which set out, in theory, some of the commonalities across these services in terms of things like opening hours and prioritization of patients. And worth noting here as well, the model that I was intending to build was a sort of generic UTC model. I wasn't focusing on one service in particular. And the data that I was using the emergency care data set, and I took urgent treatment centres from that data set based on the data quality they had. So it's a generic model. So the first thing I did was look at, for urgent treatment centres where booked appointments have already been adopted, has that had a positive impact on performance? And by performance here, I mean percentage of patients admitted, transferred or discharged within 4 hours of arrival. So I looked at the latest data at the time, which was January 22. And this data includes UTCs and also other department types which are similar to UTCs. So only about 5% of appointments were booked in the data, but this did vary by trust. So you can see you've got one trust over here where for these department types, 100% of appointments were booked in advance, whereas many 0% of attendances had a pre-booked appointment, and you've got a bit of a distribution there in between. Average performance was better for booked attendances, so 99% of patients was admitted, transferred or discharged within 4 hours, compared to 97% for unbooked attendances, and that was statistically significant at trust level. But there wasn't a significant correlation between the percentage of attendances that were booked and the overall performance, which you'd kind of expect, because when you've got such a small percentage of attendances that are booked, you wouldn't expect that to have a significant impact on the performance overall. But then there's this natural question. So if the booked percentage were higher, would this lead to a noticeable improvement in overall performance? So again, that's kind of the question that I was trying to answer. So the first thing I looked at was how are booked appointments going to affect the profile of arrival times. And on the left here are the scenarios I ended up considering in the model. You've got the current situation. This is specific to UTCs now, so there's a slightly higher percentage of attendances that are booked, and that's this black line on the chart. So you can see in the current situation, you've got a peak in attendances around mid-morning and lower attendances in the early morning and later in the evening. And I assumed that the booked slots available would have a flat distribution. So as you get up to higher percentages of attendances being booked, you get closer to that flat distribution, and the number of patients coming in to the service is more constant throughout the day. And I will just note here, I've considered percentages all the way up to 100% of attendances being booked. That's not to say that that's going to be realistic for all services, but I did want to investigate that situation as well, just to get a fuller understanding of the system. So the next question I kind of asked was, what actually happens to patients when they arrive at these services? So again, I used the emergency care data set and used lots of process mapping to sort of try and unpick this. And you can see this flow to the right here represents the fact that as I was looking in more detail at the data and the data quality and excluding records which didn't look realistic, I ended up at a more simplified pathway. You can see on the left here, you've got lots of arrows going in all different directions and this slightly simplified view by the end. So for example, in this initial flow, you've got 11,000 patients who went straight from arrival to departure without any initial assessment, investigation, or treatment. But when I looked in more detail at those records, I could see that there was some evidence of sometimes treatment, sometimes investigation on those records. But the timestamp of when that had happened hadn't been coded, so it wasn't showing up in the process map. And since I didn't have full information about those patients, I was able to just exclude them. And that's how I kind of arrived at this simplified view. I also did some similar work kind of looking at the flow using Sankey diagrams. So again, initially, I'm seeing all sorts of loops of patients going from treatment back to initial assessment and from investigation back to initial assessment. And whilst this is likely to be realistic in some cases, in order to build a kind of stable model in the time I had available, I did have to simplify the system. So there are some kind of pathways that I have to exclude just to make the system manageable to be able to build the model. So as my kind of simplest version of the system, I arrived at this where patients arrive, they have an initial assessment, some then leave or are directed to other services and I stop modeling them, so that's a departure. Some need some treatment and some depart after treatment, others need further investigation and then they depart after that. So that's what I built using SymPy, and I will just flick over so you can see the model running. So this script in particular, some of the parameters in the model I'm able to get from the data, others I don't have data on. So for example, I'm not able to say from the data the average time it takes to treat a patient. And so I give the model the parameters that I do know from the data, and I tell it what the waiting times are. And then if I run this, what the code will do is choose some parameters, see how close the results are to the actual waiting times, give me an error, and then try some new parameters. And it does that until it's able to find parameters that give a good fit to waiting times. So the project is unfinished, but I have put some preliminary results here, and you can see as the percentage of attendances with a book time slot increases, we get this decrease both in the average waiting time for initial assessment and the total time in department. It is likely that these will change before the final results are shareable, but I thought I'd put that in there just to show some results. I've got some next steps here. In the interest of time, I probably won't go through these in detail, but I did just want to say a bit about the kind of impact of HSMA on me and the organization. And the most important thing to say is that it was a really enjoyable experience. I did have some kind of modeling and data science experience before starting the program, but it's been really useful, firstly, to get a bit of an overview of all the different techniques that are out there so that when a problem kind of comes along, I'm able to say, okay, well, this is probably the type of technique that we might use for that problem. And I know where to look to get more detail, but then being able to do a project as well and kind of lead on that, present it to stakeholders and follow it through has also been a really positive experience. So yeah, that's it from me.